In previous videos, I have discussed how electricity, and more specifically plasma, could have some exotic use in various fields such as aerospace, energy transmission, telecommunication, and of course agriculture with electroculture and plasma culture. Interestingly, it seems that my viewership has shown some interest in plasma applied to humans. So in this video, I will talk more specifically about this topic through 2 comments from my viewers. Keep in mind that this is for entertainment purposes only, and nothing in this video should be interpreted as medical advice. Consult with your preferred scientist, doctor, nutritionist, shaman, or spiritual leader. They best know what is safe and effective for you.
I'd have to laugh at that.
Let's start with a question from a viewer who, after watching my video on the Osirian, asked me whether there were studies on drinking plasma-activated water. As a reminder, in that video I briefly discussed about the anecdotal experience of people who reported health benefits, such as improved eyesight, after drinking the water of the Osirian. The short answer to the question of the viewer is no, there are no peer-reviewed studies on the effects of drinking plasma-activated water. There are, however, some interesting case reports, including this one from American clinical psychologist Burton Dannett and his treating doctor Stephen Tunnell.
Mr. Burt Dannett has been under my care intermittently for various musculoskeletal injuries since 1995. During this time, I have evaluated Mr. Dannett on numerous occasions and have followed his rehabilitation closely. I've seen Mr. Dannett's physical limitations grow in the recent years. Mr. Dannett's past history includes 4 motor vehicle accidents that have produced cervical and lumbar pathology, including herniated L4-5 and L5S1 discs that produce narrowing of the neural foramina at these same levels, as well as a moderate narrowing of the central canal at L4-5. This has been confirmed on multiple MRI and CT scans. Mr. Dannett has spent long hours typing and transcribing for years. This has produced repetitive stress injuries in the hands, wrists, forearms, arms, and shoulders, as well as neck pain, low back pain, and headaches. The patient had a serious fall several years ago in which he was hospitalized with head, neck, back, leg, and arm injuries. To make matters worse, Mr. Dannett suffered a minor stroke during the past couple of years. I haven't seen Mr. Dannett in many months up until this recent reevaluation. Mr. Dannett requested an evaluation. If I had not received a brief history over the phone, I would have assumed he had an additional injury that required treatment, but he told me he was feeling great. I evaluated Mr. Dannett on January 15, 2006. I was surprised to see him in the best physical condition in my years of knowing him. Mr. Dannett was strong and without loss of motion in any of the previous regions of injury. His only loss of function was a light sensory loss from his stroke. He requested that I watch him speed walk following the assessment, and I could not keep up with his pace unless I jogged. Mr. Dannett stated he's been feeling more alive, vibrant, and energetic than he did at 26 years old. He reported an increase in energy, cardiovascular endurance, exercise capacity, and focus in the recent months. He stated that he could now sit upright for over 2 hours without pain. He previously had lain in a semi-recumbent position for less time prior to the onset of pain. Mr. Dannett reported he no longer has headaches and he has not had a need to take Advil. He also stated that he has an increased healing response that has helped in resolution of his actinic keratoses and a correction of his blurred vision. The recent addition of plasma-activated water has corresponded to all the previously stated positive changes in his health. I am amazed at the dramatic transformation in Mr. Dannett. With Mr. Dannett's history of a degenerative spine and the many other injuries, I expected that his physical limitation would continue to grow. I can only say that the changes in Mr. Dannett's musculoskeletal condition appear to be miraculous.
Whether the Osirian and the pyramids were built by ancient Egyptians or not, it is commonly accepted that they did know about electricity and that they practiced some form of electrotherapy. The hotly debated Dendera light comes to mind, but no need to go against mainstream archaeology and Egyptologists to prove this point. Indeed, ancient Egyptians depicted the electric catfish of the Nile in their mural paintings and artworks. Additionally, ancient Egyptian writings record the use of the electric catfish to relieve pain almost 5,000 years ago. The second comment that inspired me to talk about electrotherapy is from a viewer who, after watching my video on electroculture with a simple apparatus I designed to produce plasma using a high voltage module, decided to test a skin therapy wand on plants. For people who are not familiar with this beauty device, it is sold under different names by different brands, like high-frequency facial machine. It generates high-frequency currents, typically between 300 and 500 kHz, that are used for various cosmetic and medical applications, such as treating acne, improving skin appearance, and promoting hair growth. The current produced is not only high frequency, it is also high voltage, up to 3 kV, but at very low intensity, which makes it safe for humans. The device works by sending the high-frequency electrical current to the skin via a gas-filled glass electrode that glows when the gas inside is excited by the current. At the other end of the spectrum, so to say, there is also the radio frequency technology devices, which produce low-frequency electromagnetic waves to improve skin firmness, reduce the appearance of fine lines and wrinkles. Interestingly, this technology is often called low frequency, although the frequency is in the ballpark of 450 kHz to a few megahertz, which is indeed considered low frequency in comparison to, say, Wi-Fi radiation at 2.4 or 5 GHz, but higher than the frequency of so-called high-frequency facial devices. The radio frequency technology devices actually also produce alternating current, but the radio frequency energy penetrates the tissue deeper and is able to stimulate the skin collagen at a higher temperature. Many studies have been published on these home-based devices, notably this one published in 2021, which passed through 670 articles and reviewed 37 clinical trials involving close to 2,000 patients. The authors of this paper concluded that home-based devices are efficacious and safe for a number of skin conditions, including radiofrequency devices for wrinkles. Of note, the authors declared that they have no conflict of interest. In 2022, a Chinese team from the Sichuan University published this paper where they compared the efficacy of a radiofrequency device with that of a marketed anti-aging cosmetic product on 33 women during 3 months. The study found that stains, wrinkles, and skin thickness improved more on the device side than on the control side with the cosmetic agent. The paper does not contain a conflict of interest section, and it should be noted that the study was directly or indirectly funded by the manufacturer of the radiofrequency devices used in this clinical trial. If you still have some doubts about the efficacy of electrotherapy in the cosmetic sector, you may be surprised to learn that this technology has also been shown to be effective for wound healing. For example, in this study on 30 pigs, published in 1999, the research team found that both AC and DC reduced healing time on a porcine wound. They also showed that DC seemed to be more efficient than AC to reduce the wound area, while AC seemed to be more efficient than DC to reduce the wound volume. Just like in the cosmetic industry, the mechanism by which an electric stimulation accelerates wound healing is still not very well understood. But since this study, published in 1983, it is widely accepted in the scientific community that our skin generates, by ionic exchange, an electric potential, named the skin battery, which plays a key role in wound healing. During a skin injury, the skin battery is rearranged so to produce a current of injury, which flows from the area around the wound toward the center of the wound. It has been shown that a decreased current of injury was detrimental to wound healing. Conversely, an increased current of injury was beneficial to the healing process. Other experiments have also shown that healing cells moved into the wound faster when an external electric current is applied with the same polarity as that of the natural current of injury. With a reversed polarity, the healing cells moved away from the wound, opening it. Besides current polarity, other important factors are still not very well understood, like the role of magnetic fields, as the electric current produced by an electric stimulation is always associated with a magnetic field. Not fully understanding how something works does not preclude from verifying that that something actually works, as seen with electrotherapy applied to cosmetic skincare or more serious wound healing. So let's crank it up a notch with electromagnetic therapy for trauma treatment. As of the making of this video, there are many products offering electromagnetic therapy on the market, including parallel markets. Parallel markets are often synonymous with scams, so buyer beware. Some of those products are not safe, others are not effective, and almost all of them share a common attribute. They are outrageously expensive. We are talking tens of thousands of dollars expensive, very far from your average $100 skin therapy wand. The manufacturing cost is most of the time a very small fraction of the retail price, allowing the organizations marketing and selling those products to pocket indecent profit margins outside of the regulatory environment. A case can be made that early adopters are often willing to pay a premium. This could be a valid argument, but if you are contemplating becoming an early adopter of an electromagnetic therapy device, remember that a guinea pig is not an early adopter. And while modern science is still playing catch-up, this technology has actually been around for a long time. More on this on the second part of this video. With that being said, what does the latest science say about electromagnetic therapy for trauma treatment? I talked earlier about AC and DC currents, but actually the most documented therapeutic approach is probably pulsed current, and more specifically pulsed electromagnetic fields. For example, this paper published in 2023 reviewed over 40 studies on this technology applied to bone healing, neurological diseases, dental implants, pain management, arthritis, and even cancer. One of the main challenges faced by researchers is the wide range of treatment parameters, such as the electromagnetic pulse shapes. In wound healing, we saw that a reversed polarity can actually lead to the wound opening up. Similarly, it has been shown that with the electromagnetic pulse technology, both positive and negative effects have been observed. I've made videos where I showed how some of my plants actually died shortly after being exposed to my homemade plasma generator, while other plants thrived after being exposed. There are actually recent scientific studies performed on humans. For example, exposure to electromagnetic pulses before the start of a chemotherapy can reduce the efficacy of the cancer treatment. For the electromagnetic pulses to have a positive effect on cancer cells, they have to be applied concurrently with the chemotherapy treatment or after. If you happen to be the owner of an electrotherapy device and it has been working great for you, don't let this video discourage you from continuing to use it. The message here is more about erring on the side of caution when it comes to products marketed and sold on parallel markets. This is a field that strangely has often shifted back and forth between science and pseudoscience for more than 100 years. There could be many reasons for that. One reason could be that the technology works, but early scientists could not explain why. Another reason could be that scientists and medical doctors were not the only people who studied electrotherapy. Among the early people who studied the effects of high-frequency currents on humans, Nikola Tesla seems to have a special place within the alternative medicine community and people who believe he invented a free energy technology. While Tesla eventually contributed to the field of electrotherapy with the Tesla coil, his knowledge about electrotherapy and human physiology were actually rather limited. This of course did not prevent him from suggesting the use of high-frequency currents in medicine in 1891 and publishing a paper on this subject in 1898. Interestingly, Tesla never really acknowledged the work of French physician and biophysicist Jacques Arsene d'Arsonval, who had been studying medical applications for electricity since the 1880s, a decade before Tesla. It was d'Arsonval who discovered that frequencies above 10 kHz did not cause electric shock, but warming. By the way, today the skin therapy wand is sometimes called the d'Arsonval wand. D'Arsonval's ideas on high-frequency electromagnetic fields were acknowledged by another inventor, Georges Lakhovsky, who built a medical device he named the multiple wave oscillator, for which he filed a patent in the 1930s. Lakhovsky first successfully tested a prototype on plants with a bacterial infection, and later treated many cancer patients with remarkable results under the supervision of renowned French surgeon Dr. Antonin Gosset. However, the French Academy of Medicine pressured Dr. Gosset to not publish Lakhovsky's results. Nevertheless, Lakhovsky presented his work in his book The Secret of Life, published in 1929 and prefaced by D'Arsonval. This book is a must-read for gardeners interested in electroculture and plasma culture, as Lakhovsky discusses in it some of his ideas and experiments on cellular oscillation, cosmic radiations, and the vibrational nature of life. The suppression of Lakhovsky's work by the scientific establishment is quite puzzling, but not an isolated case. It took American inventor Thomas Henry Moray 17 years to get his patent application for an electrotherapeutic apparatus to be approved by the US Patent Office in 1949. Moray's invention involved using high-potential, high-frequency electricity delivered by special discharge tubes that served as treatment electrodes for therapeutic purposes. Just like Lakhovsky's hypothesis about the influence of cosmic radiations on plants, Moray's work was part of his exploration of energy, which included claims of drawing electrical energy from the atmosphere. In fact, earlier in the 1920s, on the heels of Tesla's inventions for wireless energy transmission, Moray had invented an apparatus capable of producing electricity with no exterior energy input. For this earlier invention, the US Patent Office rejected his patent application. But this is another story. The development of parallel markets for electrotherapy devices may have been a response to the suppression faced by early researchers and inventors. Parallel markets are markets where electrotherapy devices are not marketed as medical devices.
Sell me this pen.
To avoid being subjected to the oversight of regulatory bodies such as the FDA in the US. A case in point, this designer and manufacturer of an electrotherapy device received a warning letter from the FDA. It seems that since then the firm has stopped selling its product as a medical device. Other manufacturers have resorted to New Age terminology like subtle energy, quantum healing, or healing ether, and some other creative marketing schemes. But over-regulation can also stifle competition, leading manufacturers to opt for parallel markets to avoid compliance costs. However, instead of passing the cost saving to daring early adopters, parallel markets are actually a wild west, where the pricing practiced is often very high. This contributes to diminishing the confidence of more mainstream consumers, at a time when many of the early patents have expired, and any skilled technician can replicate and enhance a design with the latest off-the-shelf components without fear of a patent infringement lawsuit. As modern science is slowly catching up, there is the possibility that a new equilibrium state will be reached, with more competition entering the market, which hopefully will help lower the barrier to entry for less well-off consumers, while offering safer and more standardized products. Do not hold your breath though, as recent worldwide events have shown us that cheap and effective treatments have been disparaged by the scientific establishment in favor of more expensive, ineffective, and sometimes unsafe solutions.